Hello, I'm Stephanie Yager, and I'm a student at the University of Maryland School of Pharmacy. I'm presenting my research project on the impact of incident depression on healthcare utilization among Medicaid patients with diabetes. I completed this project with the help of Dr. Shaya and Dr. Brunig. To give you a brief background on the comorbidity, depression has been shown to be twice as common among those with diabetes. Depression is associated with adverse diabetes-related outcomes, including difficulty in self-management, worse glycemic control, and increased mortality. Care for the comorbidity has been perceived as fragmented by both providers and patients. This study aimed to contribute to the understanding of the added burden of depression on diabetes. We conducted a retrospective cohort analysis with a Maryland Medicaid population who had type 2 diabetes between 2005 and 2010. A cohort of patients, which we called cases, was selected, ages 18 to 64, first diagnosed with depression at least 1 year after type 2 diabetes diagnosis was first observed. We matched the cases to a control cohort of patients with type 2 diabetes free of recorded depression. Incident depression cases were matched with control cases based on age, race, gender, and month and year of index date. We measured the differences between the number of overall and diabetes-related hospital, outpatient, inpatient, ER, and physician visits between cases and matched controls. We measured if there was a larger increase in utilization from the year before depression diagnosis and the year after depression diagnosis for cases as compared to controls. We used the t-test to examine these differences. To summarize these methods in more simplified terms, during year 1, all the patients had diabetes. During year 2, cases had diabetes and incident depression, and controls had diabetes alone. We compared medical visits for cases versus controls during year 2. We also compared medical visits for cases year 2 minus year 1 versus controls year 2 minus year 1. We compared overall and diabetes-specific medical visits. Table 1 on the right-hand side of the poster shows the population demographics of the study. There were 908 patients in each cohort. The majority were female, African American, in their 40s and 50s. There was no significant difference between the number of diabetes medications or the diabetes medication possession ratio between the cases and the controls. There was a 4.3% increase in the number of patients on insulin in the cases from year 1 to year 2, compared to only a 1.8% increase in the controls. Figure 1 shows the differences in total diabetes utilization. The y-axis shows the mean number of visits. By looking at the red bars, you can see that a total diabetes-related utilization was significantly larger for the cases in year 2. By comparing the red and yellow bars, you can see that there was a larger increase in diabetes-related utilization from year 1 to year 2 for the cases as compared to the controls. Table 2 shows the rest of the results. The column on the left shows the encounter type. The other columns compare patients with diabetes and depression to patients with diabetes alone during year 1, year 2, and the increase from year 1 to year 2. The boxes highlighted in red show significant p-values, and the boxes highlighted in yellow show non-significant p-values. All encounter types showed a significant difference in year 2. All encounter types except for patient visits, inpatient visits, and diabetes-related ER visits showed a significant change from year 1 to year 2. We observed a greater utilization of nearly all types of medical services for cases in year 1, the year prior to depression diagnosis. This is surprising, and this points to a potential delay in the diagnosis. We observed less of an increase in diabetes-related inpatient and ER utilization associated with incident depression than we expected. The increase in utilization was mainly driven by medical encounters for outpatient hospital and physician visits. Overall, depression in patients with diabetes was associated with an increase in total health care utilization and diabetes-related utilization. Our findings suggest that depression adds a significant burden to the management of diabetes and should be a main component of consideration in medication therapy management.